Residents with dementia in assisted living communities spend a large part of their day disengaged, often napping and watching television. And activity programming in these communities tends to be a one-size-fits-all approach and not tailored to the individual. So when residents particularly those with dementia, become disengaged and bored, we often see an increase in agitation and other behavioral symptoms. This can be agitation, aggression, resistiveness during care interactions, and it can be really distressing and challenging for the staff to manage. And these behaviors are usually a sign that their needs are not being met in some way. So in our research, we use meaningful activity as a way to help decrease behavioral symptoms and improve residents' overall quality of life. We all know what it feels like to do something that's meaningful and gives us a sense of purpose. For a resident with dementia, that might mean helping to set the table at mealtimes, or participate in their own self-care, or even re-engage with interests like doing music or dance or art. And when residents engage in meaningful activity, it fosters a sense of purpose, brings them joy, and it can also help to manage behavioral symptoms and improve their overall quality of life. Our team developed meaningful activities for assisted living, which is a theory-based approach and helps communities integrate meaningful activity into everyday care. So the goal is to make what we call meaningful moments a part of the routine, not something that's extra or separate from care. So this approach includes 4 steps. Step 1 is partnering with the community stakeholders to identify their goals and assess the environment and policies within the community. Step 2 is providing education for staff. Step 3 is evaluating the residents' individual preferences for meaningful activity. And step 4 is really mentoring and motivating the staff and the residents to facilitate engagement in meaningful activity. So ultimately, we're trying to change the philosophy to focus on optimizing meaningful activity each day for residents with dementia. We developed a pragmatic tool that asks questions about the resident, gets to know their background, what's meaningful for them, and then puts together sort of an individualized plan for meaningful activities for the individual. For example, if a resident is interested in music and has experience playing or teaching the piano, it might mean that you help encourage them to play the piano during the day. Or if a resident was a teacher and enjoys standing up in front of the room, maybe they're part of passing out the materials and supplies for activities. We found that residents who were exposed to this meaningful activity approach had decreased behavioral symptoms and improved quality of life after about 4 months. When provided with practical tools and support and positive reinforcement, the staff were able to engage residents in daily meaningful activity, and then the staff saw for themselves the positive impact it has on the residents. Assisted living communities are caring for more residents with dementia than ever before. And meaningful activity is something that most of us agree is important for caring for residents with dementia, but it's not consistently integrated into routine care. So without research on innovative care approaches, we're not able to know what actually works and how best to implement it in the real world. So our research is focused on developing evidence-based approaches that can be directly applied within the communities. And in doing so, hopefully helping to make each day a bit more meaningful for residents with dementia.